Hello everyone, welcome to this week's Milk Minute. I'm Sara, the lactation consultant, IBCLC, here at Health Foundation's Birth Center and Women's Health Clinic. This week's Milk Minute is continuing along the lines of the last few Milk Minutes in myth busting, some common breastfeeding and milk myths. So this week's myth is that all babies that are breastfed need to be supplemented with iron and vitamin D. And while I always will suggest that you check in with your healthcare provider about both iron levels and vitamin D, the blanket statement that because you're breastfeeding your baby needs those supplementations is false. And the reason being that the amount of iron that your baby gets in the last few months of pregnancy is stored and is what your baby's body uses in those first few months of life. And that's why breast milk is lower in iron than infant formula. And so if your iron levels are wonderful in the last few months of pregnancy and your baby came full term, there shouldn't be a reason that you need to supplement with iron outside of other health concerns. So definitely chat with your doctor or healthcare provider about those topics. Now, on to vitamin D. Vitamin D takes a while to build up in your system and to be at a healthy level. So here at the birth center, the midwives discuss with you your vitamin D levels for optimal health while you're pregnant. And while maintaining optimal vitamin D levels is super important for all times in your life, maintaining your vitamin D levels towards the end of your pregnancy will actually assure that your breast milk has adequate vitamin D to transfer onto your baby. And that, along with just having a lifestyle that allows you to be outside in fresh air, is going to be helpful to assure that your baby's got adequate vitamin D. And while breastfeeding, it isn't necessary to just tell that every baby needs to have vitamin D drops. Now, that said, everybody and everybody's baby is a little bit different, has different health needs. So definitely, again, make sure to discuss these items both with your pediatrician, healthcare provider, and your midwife to make sure that you are set up and everybody is getting what they need to be healthy and happy. So I look forward to seeing you again next week, where we were going to spend some time busting another couple of myths. So have a great week.